Hello, everyone. Good evening, my friends. So, I was always talking about healthcare policy not working adequately, right? But the recent policy changes are really concerning physicians and the healthcare providers, right? That is what is happening, and I want to give you a light on my perspective on the coming changes and how the consequences would be on health of elderly, health of children and women, and also workers, right? That's a very concerning thing, you know. And other thing is, are there any solutions to encounter? Can we be better equipped by our awareness, by our resources, or just being conscious about our wellness and preserving it, not depending upon the healthcare industry to repair it. If you could help it, it's not that you could do 100%, but a lot of it, you could do. You can improve your wellness ways and habits and do that. We're going to come to the last. Okay, what I'm talking about is this uh, big bad bill or big beautiful bill, whatever they call it, uh, that had taken away a lot of Medicaid coverage starting in 26. So people in nursing homes, people in rest homes, and people who are elderly, and a lot of people that don't have income, low income, they all rely on the Medicaid. So many institutions rely on the Medicaid support and all that. Okay, so the Medicaid itself is not paying enough to the doctors and hospitals, so a lot of them don't want to see them to begin with. Okay, because if you are getting, I remember our hospital told us we get 5 cents on every dollar we spend on a Medicaid patient. So they are after us to send them quickly, even though they were sick, they were old. We have to discharge them, right? That's the pressure they brought us all the time. So they're always worried about the payment. They're always worried about we cannot afford it, and so we cannot do this test. We cannot keep them for longer. So discharge them. Okay. And so it was a tremendous pressure on us as physicians because we don't want to send somebody home who is not, really well, right? So it's a real issue. I remember one case when I went on the duty in the morning at 7 o'clock as an hospitalist. My chief had discharged the patient from the clinic, but then the patient happened to be on my service. I took over his service, right? So the family came to meet me and they said, no, 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 doctor, you have nothing to do with it. You just came on. But the doctor who sent my grandma home, she is not in a shape to go home. She is very weak. She cannot support. And nobody even called us. So they were furious because their concern was she was left alone in a condition where she is not able to get up and walk, and she could fall. And she could get into all sorts of problems. Genuine concern, real concern, right? But why did the chief discharge her? Because he felt she doesn't need to stay there because there won't be payment on her next day, you know. But he did not arrange for the physical therapy. He did not arrange for somebody to be on her for a night or inform the family. None of them. So these kind of mistakes are done because the chief had so many cases, maybe, and he had to dispose of each case, and then he wasn't thinking much about it. These kind of mistakes happen, and then elderly people are put on danger. Okay, so that is the big bill that they passed, right? And then now the Obamacare had these incentives, discounts that the government gave, so it became much more attractive as a price thing. Okay, so a lot of people bought it, and then Democrats passed it, but then they left like a clause where it can be expiring in end of the 25. So from January 1st, you won't have any discount. So the price of insurance policy is going from 988 for a year to 1980 or something like that. Enormous increase. And how come people afford to eat, afford to get the medications, afford to pay the rent or mortgage, and also do this big insurance? So I'm anticipating lot of trouble for a lot of people unless Congress realizes that I need to give these discounts for that. Debate is going on, right? So it's a the whole shutdown of the government was because of that, and then finally the Democrats caved in, and then they just promised. I don't know whether it will be empty promise or not. We don't know, but Republicans have their own issue because they want to keep costs down and all. But if you take the uh, healthcare costs, do you have any idea how much we spend for the healthcare? Well, a simple figure is every $5 we spend for the country for so many things, defense or uh, projects, whatever we do, or every $5, $1 goes to healthcare. And at the end of it, what are the consequences? Many people do not have access to many important tests and operations and all that, and poor access, right? And also, even the people who are paying insurance premium from themselves and also to the through the employer, when they go to the clinic or hospital, they still have to pay out of their pocket. This is the reality. It's not something you aware. This is the reality. And then doctors and hospitals, they submit those bills to the insurance company and they slash them down. They don't reimburse even the cost of it sometimes. One time I did a rheumatoid profile for somebody because I wanted to see how rheumatoid arthritis everything is working. There's a blood test. A whole battery of things will be there, and they charged me $300. The insurance company paid our clinic $25. So I got to eat it, and then after that I stopped doing that because our clinic cannot afford like that. It's absolutely. So we all know how uh, really broken the healthcare system in that we have the technology, we have the science, we have the doctors and nurses highly trained and very sincere working and all that. But we have these insurance companies and we have these executives and we have these pharmacy companies. A lot of money is gobbled by this unnecessary testing or legal system, and anyway, people don't get the right health care. That's apparent, and this is going to probably may get, unless they come around and then make these discounts to continue. They were talking about at least for 1 or 2 years. They would like to extend them. If they extend this, but otherwise, all the people who are on the ACA care, that's the Obama care, they will have to pay a lot of money. Okay, so have you been following this? Have you been understanding what's going on with healthcare? And also, they have done so much with the CDC and NIH and other institutions of the healthcare that many people depend on them. CDC, for example, you want to find something about a disease in a particular country, you go there and then find it out. You want to see what are the recommendations for the vaccine, for example, you go there and find out. You rely on that for so many ways. But then this attack on the science and the attack on the really doing stuff that is good for epidemiological, all those things are eroded now with the new policies and new director of the HHS. We are really having real trouble understanding his emphasis on data, and that's not supported by scientific research. Okay, You are aware of all this, right? All these changes going on. So I have been watching them. I'm very concerned about what is going on. But at the same time, I increased my activities of promoting prevention, promoting really proactive wellness. Be active, be proactive about your wellness health. I have been promoting that for some time, but more so now. Okay, so I want to bring this here and engage you all. See if you agree with me. What is going on is really probably not good for our healthcare and the healthcare of our people, right? Elderly, children. And see, all this ACA insurance policy holders, many of them are mothers and children. Many of them are older people. So private companies give some insurance, but then they cut down so much because they feel that's a very heavy burden on them too. But rich people who have a lot of money, above 400,000 and all that, they are able to get Cadillac like insurance. Even the Congress, it gets a Cadillac like, so they don't have to really feel the pinch as much as the regular life. For example, people like me who are really knows about the in and outs of the healthcare system, and also knows when not to get sick, and when try as much as I can by being proactive. But I do it first, then I'm telling you, right? So there are ways where even if you don't have all these policy changes, there are ways where you can be healthy, well, by your own proactive choices. That is what I always talk about. So you come up and tell me what you feel about these things, and then if you have any specific questions that I could answer you, I'll be happy to do that. Okay, but this is a concerning situation. The consequences are going to be dire, and then a lot of people in the nursing homes may not be able to stay there because there's no payment, and they may, where are they going to go? That's a big concern. Okay, how the families are they going to afford them? Where are they going to get the money? And so, if they need some therapies, some patient care workers, they may not be able to pay them. So how are they going to get those services that are keeping them alive and healthy, or at least to survive and not do it? So I'm looking all these possible ways that things can go wrong, and community of doctors, scientists, and all the healthcare workers, they're observing it. They know what are the consequences. They know what happens if these people really, uh, you know, miss out on that payments and all. And the solutions, as I said, try to be proactive and really uh, help our wellness to come on board. Okay, so I was just talking to Cecilia about how we can make wellness as a B, and I was writing on something on that, because somebody on the show came and said she missed walking for the first time when she was injured and she was not able to get up and walk for a few weeks. Maybe she got better after that. But then at the time when she was in the wheelchair or whatever, she missed that walking. Like that, we take wellness for granted. We do all sorts of things to really derail, right? So that's not really good for us. So it's a question of being cautious and aware and proactive about things. Hi, Heather. Hello.
Hello, can you hear me?
Yeah, yeah.
Hello?
Yes.
Okay. Y'all talking about the healthcare policy plan? I worked for 14 years for a hospital in Texas. The OSHA always changing this, changing that.
Yeah.
It's a headache because they are changing something with the rules. You know what I mean?
Yeah. So, I was, as a doctor, I got so frustrated because I invested my own money in my clinic, right? I owned everything and all that.
Yeah.
And
yeah, Go right ahead.
Yeah, we were spending money, but we were not getting the money back in 3 to 6 months.
Exactly.
Yeah.
For the people that's going to somewhere else. Oh,
Yeah.
you're getting this, but you're not getting what your clinic wants, and this is what's going on, and you won't get the money back because this is what they need, and you need your clinic needs more of this and that than they do. It's just a wishy washy everything.
You remember, Heather, that
years and years and years.
Yeah, you remember that United Health executive. He was murdered by somebody. Because
oh yeah,
what they did. They had this AI tool that kind of digs out your data, your file, and identifies how they can refuse the claim.
Yeah, exactly.
See,
where I used to work, I do ER and ICU because I clean. I'm a custodian. Used to clean for a hospital here in Texas.
Yeah.
And anyway, so all the COVID was going around, almost killed us.
Yes.
Because we were cleaning walls and everything, and man, it almost killed us.
Yeah.
And all our employees, all our staff had it over 4 or 5 times, and they were wondering we're going to get the COVID shot or not. It was mandatory for us. And they kept going back and forth. Was it wasn't not. I mean, you got to wear a mask. I mean, it's just a chaos mess.
And also the long COVID. When you thought it is gone.
Yeah.
So I was.
Everybody had it at our hospital except for me because I have immune system disease.
Yeah.
And everybody had it. My whole family had it. I'm the only one that did not have the COVID.
Yeah. I did not have it, luckily. But I am in touch with the people who are having long COVID. Even now, I cannot train them.
Oh, yeah. It's nothing to do with it. It's just like a virus.
Yeah.
One of the nurses told me that I used to work with, it's just kind of like the flu. It floats in the air. It's kind of like airborne. You had to go, but nobody knows this.
Yeah.
Everybody keeps saying, they're dying from COVID. That's bull crap. Yeah. You got to look in their history of their health file to see what they dying from. That's when they die from, not from COVID. It's something to do with their health history.
Yeah. These are long-term illnesses, underlying.
But people do not realize that. You know what I mean?
Yeah. That's what I'm saying.
No, you don't know what's going on in their health problems.
Yeah. That's what I'm saying all the time. Be aware of what's going on with you. Listen to your body. Listen to your routines. Identify the illnesses very early and then seek the medical help or know how to take care of those things and then take care of yourself. I am for that from the beginning. Root cause. What is the cause? Go there and find out and get things early. And don't depend upon just because you have an insurance card, you think everything will be taken care of.
No, just go ahead.
Yeah.
Just talk to your doctor about it first.
Yes. Very important. And you know what? I went and learned my billing and everything because I wanted to know the whole system. And there's so much money goes out of the medical system to the executives, other things, but it really doesn't go to the patient care itself,
Well, it's nice to meet you. I live in Texas, so I hope you have a good day and everything.
You too. Thanks, Heather. And she's
experienced. You too.
Yeah.
You too. Bye-bye.
Yeah, bye-bye. She is experienced in billing, so she sees this problem of economic absurdities in healthcare, so I know their frustration because they have to submit the same bills again and again, and they have to talk to people on an everyday basis sometimes, telling them, oh, this patient needs more care, he needs to have, and then they have to, somebody sitting somewhere, they want to approve whether the patient needs or not, whether medical necessity or not. So a lot of our time is spent talking to the insurance companies, If not the billing person, if not the nurse, the doctor has to talk to them. I have to give them a reason why this is a medical necessity, why this patient has to stay or get some tests done, this pre-approval, or a lot of nonsense. Actually, this is the only industrial rich country that doesn't have this healthcare as a privilege, as something really give them because it is needed. So they don't do that, and then people are sleeping too because they sleep on their wellness being disturbed, illness is brewing. They sleep on the state of affairs with healthcare expenditure and all that. They sleep on this outrageous insurance companies' practices of denying care. And this is really so horrible if you look at it one way, because we are not attending to people getting better and going into society and get, but we are allowing all sorts of things to come on us. Okay, so I'm really concerned about these policy changes, and I do follow them with all my busy things and all that. I do follow them. I do listen to the what is going on in Washington, what is going on in the healthcare industry, what are the policies that will influence the healthcare, how is going. The other day I was listening to AI in healthcare. Fascinating, beautiful. We can do a lot of things. Will the advantage that we're going to reap from the AI implementation in healthcare, will the patient get the benefit? For one thing, I can just give them Dr. Gupta's side and then tell the patient to get educated about his illness or her illness, the medication she's taking, the allergies that she have, everything she can go through and be more empowered with the knowledge about her own condition or that particular disease, and see what is the research is saying, what is the come up, what are the ancient systems where they were employing some healing systems. Check it out, all that. So I want to empower my patients whoever I saw now. Now I don't see in the clinic, I see on the online, and people call me and ask me suggestions, right? Old patients also do that, but I don't do give prescriptions, but I give education and advice, right? And also I want them to check with their doctor most of the time, and they can go with a set of questions that they learn to ask because my interaction with me, and then they can get more information from the AI, or they can go and verify that information with that provider. That is a better way to go. Research whatever you want on the internet, but don't take it for granted. Some are internet sites are legitimate, some are not. So that is also another role I play. What is a legit information, what is not? This is all looks like a lot of work. No, because we've been in the system for about 50 years now. So it is kind of, I was a doctor at 23 and now I'm 70, right? So we are around 50 years, right? So I was not just practicing doctor, but more like taking health policy interest. How is health policy formulated in around the world? How is it that we don't have that kind of care here? How is that in Europe and other places where they really feel healthcare is not a burden? But here, it is a burden. So that's why I advocate people be self-responsible for your health and wellness. What I bring in is so important for your proactive wellness so that you don't suffer the illness. But it doesn't happen just like that. You got to do a lot of homework, lot of proactive activities. That thereby you really take care of your wellness by following all the pillars we talked about. There's so many people coming and advising you, but that may be piecemeal. Okay, you want to develop a problem, then you want to treat it. That's way too late sometimes. Okay, so I think this is a very responsible uh, way of being in the upcoming few years, couple of years, because we're going to lose more and more insurance privileges. Insurance will be more rational, and insurance will make you go to emergency rooms or hospitals, and that's a very expensive way of getting the health care, right? People just walk into the emergency room, and then there's a very, very expensive way to do it. Like Heather will tell you how expensive it is in emergency room and also ICU care. Both are very expensive. Some patients I saw, when they come into the hospital and they go and spend a couple of weeks in the ICU, and they are bankrupt, and they have to declare bankrupt to get the Medicaid coverage. Right, Heather? That's the way it works. It's pitiable because all these elderly people who came at the time when I was really actually practicing, They were somebody who worked 50, 60 years in something and contributed to society, and then they got the Medicare, Medicaid, which are totally not adequate for their coverage. And the medications they're trying to get them down now, they have the online on-site where they're getting cheaper drugs and all. But by and large, the healthcare is rationed in this country. So in a way, you get according to Cadillac plan, that's a very high premium rate that you cannot afford, or you may have to pay out of your pocket a lot of it. That's not good either. So in so many ways, you can say healthcare is not working for us, but don't have to get desperate about it. What you can do is, let me take in charge for myself. Let me be self-responsible. Let me get the technology work for me, and be prepared for whatever it could happen. And first of all, monitor it. Second of all, once you monitor, you discover something, don't delay it because you have to take a vacation, or you have to take some time off from the work, or whatever excuse you give. I would say health is first, wellness first. Okay, so descriptive things that are going on within you, there are ways to do that. That's what I'm always pointing out. There are modern scientific breakthroughs that can, for example, in our time, we used to check the blood sugar by poking the finger. Now you don't have to do it. You just wear a watch and it will tell you. And you can monitor blood sugar continuously. You can monitor your blood pressure continuously. Take advantage of those technological advances, and also really find out what is the proper way to be well. How are the inches? That's what segment I bring in. I am this way because of I combine both, and that is what I advocate in my company. Okay, but here this healthcare concept is going to be probably dire for some people, and many people will probably have to adjust with less of care, or not adequate care, and many people for sure will suffer. So the solutions is in your hand. Your health is in your hand, and how you behave, how you do your lifestyles. And then there may be some due to genetic, due to something that you cannot help. But whatever conditions they are, you be proactive about them, and then listen to your body, listen to your, what is the inner feeling you have, how is your circadian rhythms are, how are you sleeping, how are you eating, how are you exercising, all those things. Okay, and then also protect your mind with not having a lot of junk in it. If you can do these pillars, possibly you will discover things early, and possibly you can get that worked out. So you have a good relationship with your healthcare team. Okay, and go and find out all that you can find out. If your family should have some illnesses, or you have some illnesses going on, and you are taking a lot of medications, all those. So that's what I said lots of times when people are invited to my proactive wellness workshop. That's what I do. What I make them go through a list of things that they could check by themselves, or from the history, or already done. List the blood tests, list the images, everything that you have done. And from that, you assess, okay, this is where I have to improve, this is where I have to prevent, this is where I want to monitor. Then you will know more about you, not just whether you are having a fever and sickness, or maybe you're having a bronchitis because you're smoking or whatever, right? So many things you understand. It's not enough just to go there and say, treat me, I don't have to bother you. You got to find out, you got to get involved, you got to know what is going on with your body and mind. And then with the healthcare workers or people like me who are interested to help you to devise the plan of getting well, or maintaining the wellness, or always preventing any illness in the future. Those kind of things you can plan and you can do. So what I'm saying is there's so much knowledge available about being well. You should use it deliberately. Have a personal health plan. Have a personal goals in that. Okay, then you will work accordingly. Watch what you eat. Make sure that you are exercising. Make sure you are sleeping well. Make sure you are not engaging in overwhelming your mind with lots of information. That's what is going on now. Okay. So, anybody else has any concerns, or do you actually see what I'm seeing? Do you agree that we have to be more responsible for ourselves and really make sure that we are being proactive? That word is not something fancy. I really saw people who were really in touch with their wellness when they are well and know how their wellness can be disturbed, that balance, and then they end up illness and letting the illnesses continue through the life. That is something I'm frowning upon. Do we have to do that? Or are we wise enough to really be aware of what are the earliest signs? How can I feel them? How can I understand? How can I be awake to them? And then take care of them. So earlier I was telling wellness as a way of life, not like a, oh, it will be there for me forever, and then only I will go to doctor when I feel symptoms. That may be already early warnings came to you in so many ways. Maybe you're not able to tolerate food. Maybe you are not able to work with a lot of energy. You're fatiguing, or maybe you're not able to sleep. You're tossing and turning in the bed, and maybe your mind is not stopping. It is going pretty fast, and you're doing stuff, but without really paying attention to your being. So this is why I'm saying be responsible for yourself, for your health and wellness, listening to these early warnings and taking care of the problems as it. Because if you allow the problem to continue, you may not have the insurance coverage to take care of it if it needs surgery, if it needs extensive surgery or chemo or whatever, right? So even if you are having frequent attacks of bronchitis and you're living in an area where a lot of pollution is happening, that was the case with our Clinton, Iowa. They have this Clinton cane, right? And they have a lot of a couple of factories, big ones, that are producing a lot of polluted smoke. And later on, they came and corrected it. Now we don't have that. But at the time, we have bronchitis so prevalent, and they used to call bronchitis capital, right? But then that is eliminated, that pollution liberating company, and we are having much better place now. Okay, so that kind of awareness, that kind of really trying to influence our voice in those, that helps it too. Okay, all in all, what I'm saying is profound policy changes are happening, and people who are on the top may not be doing everything for our wellness. They may doing uh, misinformation, and institutions are challenged, the CDC, NIH, like that, or even universities also. And all in all, the healthcare expenditure is very high even now. I think that's a waste. A lot of it can be saved if you are really preventive oriented in your own household. Okay, then you will save a lot of money for the country and for yourself also. But this has to be like a movement. That's why I said proactive wellness as a movement, in person, in families, in societies, in the planet itself. Around the world, there are a lot of countries are poor and not able to afford. That's one thing, and also inequality of the wealth. Only few people are holding the wealth; rest of them are not. So this is a big problem brooding coming up. Okay, so come and talk to me if you are aware of this problem. If you are concerned about this problem, engage in this discussion. I don't know whether you are doing it in other rooms or not, but I felt I should air out my kind of concern about this. And I've been talking about being well by yourself, not to get ill as easily, as unknowingly, as, just, oh, I can get sick. No, you can get sick, but you also don't have to get sick. There are so much of knowledge, so much of awareness we have. Suppose you are drinking water that's not good for you. You are living close to a company which is dumping all its chemical waste into your water supply. That's a problem, right? So you have to be aware of all these things, and then you will be taking action at the root level. So it doesn't make any ripple in anybody. I'm not talking something threatening or something negative. I'm just pointing out what is happening in my field, and I'm pointing out what could be the consequences and what how you could make your own responsibility about caring for yourself. Okay, so come to my morning routine, and where I kind of help people to prepare their body, mind, or heart for the work they're going to do, so that they're not going to be completely um, stressed out, right? And that itself is a real proactive thing for you to do, so that you are not going to have the stress influence your wellness. Okay, so that's a proactive thing you could do, preventive thing you could do. And also you can build on that. Look at your family history. Look at what your kind of diet you are eating, the same family. Look at your sedentary habits. Are you getting them from your work, from your own habits and all that? You see, you kind of change those lifestyles. See, all the life in America is not all that cracked up to be. It may be for some people, but many people are working way too much and stressed out way too much, and families are breaking, and so people are getting stressed and don't have the support also sometimes. And you don't have to be going through all that. Understand how the stress is produced, how stress. Hi, Melissa, come up. Nobody wants to come up here. So it's always like I'm coming and talking to people, but nobody has any concern about the things I'm concerned about. So that kind of bumps me out sometimes, but I still get the same spirit and come back again. So these are the people I can call: Janet, Melissa, like that. Hi, Melissa.
Hey, Dr. Rao, how are you?
I am good. You see, so I'm trying to point out all the policy changes happening in Washington, in the state, and other way in the healthcare, and how this is actually brooding to be a big disaster. You know, so
Well, I actually have a question for you. I'm in the ER right now with my mom, and
okay.
we were suggested that she's been having a lot of pain and everything, and I was going to ask you about lidocaine patches.
Okay.
Is that something?
Yeah, that's a local anesthetic that they give to give some this one. That's okay. It's not like an invasive so much. It's like a symptomatic treatment. Like we apply some creams and like that. The patches have the lidocaine release its own pace, and it will give some prolonged relief. That kind of.
It'll give her some relief, maybe, so she can get some sleep.
It depends upon where the pain is coming from and all that. Okay. But
yeah, so she's got like shoulder and her hip, and the doctor said he thinks it might be arthritis.
Yeah, that could be. That could relieve the pain a little bit, not completely. But then let her get involved into slow movement of the joints, and then also not lying on them. Maybe she's not osteoporotic. Her bones are really, depleted with the calcium. Those things can be corrected too. I'm sure they are looking into all that. That's the standard thing I told you about.
Yeah. I mean, it is definitely the laying on it is what seems to exacerbate the pain, and that's where she's really struggling.
Yeah. See, when the osteoporosis set in, your calcium depletes so much, it cannot be replenished. That's why they are not able to walk. But if you walk, the calcium will move. So bone resorps and bone builds. The building doesn't happen because you don't have that in the osteoporosis. So you got to help her to move with people, get up and walk with walker, something like that.
Yeah, the doctor did mention the possibility of utilizing a walker because she's recently started using her cane again because the mobility.
Some of my yoga routines. They are also good for her. Okay.
Yeah. No, I was telling her about the seated. Do you have recordings of the seated yoga?
Yeah.
Like what you did with Janet?
Yeah, it is there. I mean, go to my Instagram, go to my YouTube, you'll find them there.
Okay.
I've done so many years, so many are there.
Well, I remember like when Janet first started walking with you, she was having a lot of mobility issues and couldn't get up and get around. And one of the things
I never saw Janet face to face. I never saw her. I only online interaction like you.
Yeah. Yeah. No, but I'm saying like now she sent me a message the other day where she said she was up with her grandkids all day long and walking around. So I know that it has really helped her.
Yeah.
So that's why I was just thinking that,
see,
those kinds of things.
We take it for granted. Old people have become old and they can stay and then just go down. You don't have to, but you don't have to ask them to jump up and run. Just
no. Yeah, that's what I was saying. Yeah,
allow them to get up and walk and enjoy some things, that will be good enough. But you have to do with care, Melissa. But I will be happy to see her on the Zoom with you and see what we can help her with.
Oh, that would be amazing, Dr. Rao.
Yeah, set it up. Set it up, the Zoom session. When you want it, tell me what is convenient time and we will do that. Okay?
Yeah, because I told her about the sessions you were going to do.
Yeah.
It was something about aging. Remember you were talking about that?
Yeah, it's called Nurturing Elderly Wise People.
That's what it was, Mom. Nurturing elderly wise people. See, that's her. She's an elderly wise person.
Yes.
And we could use some nurturing. And I love you and I think you're amazing and I would appreciate any assistance you would be willing to offer us.
Fix it up and we will help her whatever we can. Okay?
Thank you, Dr. Rao. I appreciate you. As always, you are my yogi. I don't know if you knew I don't to tell your wife I don't mean anything by calling you mine, just
no.
I rely upon you.
That's fair. Yogi is for everybody. Don't worry about it. But you're special to Brent. Melissa is a teacher. And we talked about education and we talked about mind management and all that, So that kind of meaningful conversation really makes me motivated to come. Even one or two people come and talk to me. But the more people use this, the better for them, So it's a kind of good thing for me to come and express myself. I do that, whether I get any return or not, But it is your loss if you are not engaged in your own proactive wellness. That's what I'm promoting from the almost 40 some years of medical practice and also entering into healing as a whole. What were the ancients did? And there was a lot we can learn from. Being with the nature, being mobile, being mentally active and mentally quiet when you don't need to, and also enjoying this peace and happiness within. All those things are the gifts from the ancient wisdom to me. I enjoy them, but I also think everybody can access them. Don't have to be a particular religion. Don't have to be a particular country. Just have the sense of curiosity and open your mind and learn and then check them out and then allow them into your life. Okay? So that kind of thing is important. So watch out for these policy changes. Take interest in them. I will be available for questioning or understanding. I do follow current affairs quite well. Okay, so it's a kind of habit. Okay, so when you follow the health policy, it's very alarming. How many people are going to lose? How many people are going to use the nursing homes and so emergency rooms and hospitals? And the hospitals themselves are going to be much more benefited by the AI. Okay, there will be a lot of robots, lot of computers that will be running a lot of things, and you could increase the productivity of the hospital without really making the humane care much better. Okay, so even now, doctors don't want to really, really uh, be completely aware of the wellness measures and take care of themselves. They're burning out. Too much work for them because the bureaucratic work, the all this insurance policy thing, like I told you earlier about, these are taking your time more than your actual touch with the patients. Okay, so that's a challenge that's going on. Okay? Patients also will have access to the same tools that we have. The smart people will definitely be more equipped, more empowered because they're following. Okay, and then the solutions are, we will come to our lifestyles, many of them. And we do the lifestyles well. You could create, there is something about healing capacity of the body. So you could be more in touch with that if you live naturally according to your circadian rhythms. But most of the people are so wised up, they think, oh, late night awake is good, or eating whenever I want to eat, whatever I want to eat, what is the junk food that they serve in the restaurant. That's not the way. So I don't give a damn about this lifestyles in Western society, which is spreading into Eastern society, and everything is become the same America. Fast food lagoon, and then people are sedentary, and people have too much information. They don't sleep properly. They don't even know how to breathe, how to exercise. So many people are trying to guide you, but then if you take the percent of the population who are using these wellness methods like we do in so many ways, people are not really doing that. So we see the prevalence of high incidence of diabetes, hypertension, heart disease, COPD, smoking, alcohol, drug addiction, suicide, loneliness, depression, anxiety, so much of mental illness, so much of chronic diseases. Everybody carries 3 or 4 diseases with 40 medications. And then they just exist. And but there is a way to revive them. There's a way to make them live with what they have and also help them to come down in severity. And also, sometimes we can reverse some symptoms. Diabetes, we certainly reverse to so many people, but not that easy, right? But it can be, but not like that everybody can be doing. But some people have severe advanced illness, we will not be able to. But suppose you are beginning to be pre-diabetic, and then you kind of know this by yourself without spending any money, you can learn about it, and then you can employ those measures that will help you to be free of the illness. But if you are not interested in that, but you are only interested in going and working, doing stuff, neglecting your inner self and neglecting your body and mind, then you'll pay for it. Okay, which I don't want to see. I want to see people are well, joyful, energetic, and enjoying their life, whatever they're doing. Okay. So, Peter, how are you? Thank you for saying that. I have to bring these people by collar, so. Right, Peter?
You don't have to bring me by my collar. Yeah, I like.
I'm just kidding with you. Right?
But I do, first of all, I just want to send prayers and loving energy and healing energy out to Mama Brent, Melissa's mom, and just hoping and expecting the best for her for a speedy recovery.
Yeah, I'm going to do something about it if she calls me.
Yeah, good. Yeah, very important. Very, very important.
See, I get these chances of serving so many times in a day.
Mm-hmm. Yeah.
And you know what, Peter? The more I reach out to the many people, the more energy I get.
That's beautiful. That's beautiful.
That's the power of giving.
Mm-hmm. Yeah.
Yeah. Anyway, what do you think about what I'm talking about? I'm sure you are following this too.
Yeah, following it. There's a lot of moving parts. It seems just to stay ahead of the changes. Legislatively, that's a job in and of itself. It's not mine, but certainly.
No. But what happens, is what happens. Like it becomes a habit. So I don't have to spend that much time, but I know what's going on.
Yeah.
It's a question of awareness.
Yeah, of course.
That's all. Then you don't have to have so much effort. Suppose you are doing a paper. Suppose you are doing a presentation to some institution. Suppose you are looking at the intricacies of data, all the monies and everything involved. Then you have to spend time to dig it up. But if you look at generally what is happening with the health-wise, that is like a industry in this country.
Yeah, big time.
So that is what I'm against. I feel everybody has a right to be well, not only well for a long time, but joyously. Possibility is there. It's not complete full joy, but at least they don't have the pain that they have to suffer otherwise.
Right. And there's a whole system built around profit.
Yeah.
And it obviously doesn't serve the consumer or the end user. So you have to really be on the offensive and, like you say, proactive about every aspect of your wellness, including your medical plans and the type of care that you have, your policies, whether it's Medicaid or private insurance, TRICARE with the military. You just have to stay abreast of it because,
even when my time, when I came in 81, and I had something with family and all that, this Blue Cross Blue Shield coverage. At the time, we can take the card and give it to anybody. Everything is paid up.
And that's it. Done.
Yeah. Now, later on, I saw some co-pays, some deductibles and all that. Now, there's a percentage of the bill we have to pay.
It's crazy.
It's really crazy.
It's crazy.
Yeah, because that's unjustified, because that's why I'm saying wake up and take care of yourself. Be proactive with wellness and learn, understand, and most importantly, apply those.
Yeah.
So body intelligence is what? You are listening to your body. It is telling you, hey, something is wrong.
Right.
You're constipated, you're vomiting, or you are just feeling dizzy, or weak in your knees, or not able to get upstairs. Any number of ways, body is telling you, hey, I'm not doing well. Listen.
And there's a whole population, like I serve in the disability community, that can't even communicate their needs because of disabilities, and a lot of times their caregivers are having trouble figuring it out. I mean, they're just having trouble taking care of the individual. And that's
it is done mechanically most of the time, Peter. It's like you got to do vitals, you got to do it, but then they don't explain to them how to monitor blood pressure. Right. Unless it becomes a problem like a near stroke or heart attack or something else going on, they don't really give them that blood pressure monitor to be monitored all the time.
Yeah. I know some insurance companies were handling like giving some of that equipment out.
You know why they do that? Because after the event, there's so much big bills.
Right.
But what I want to do is look at the suffering that people can go through. Don't let them go into the suffering.
Right.
That's my mission. My mission is not about just telling them, okay, just to go and take care of yourself. My mission is, how can I cut down the suffering on a massive scale from the time I see, from the time they die?
Right.
That is the compassion box. When you have that, I don't want to have these people to, because I see the other side. When you can be joyful, energetic, and also contributing and loving your relationship and whatever you do and creating too. That is the potential each human being has. Maybe not in the same degree, but eventually
potential.
The quality of life. That's what I'm talking about. How can I improve the quality of life? That should be the motive of our physicians, nurses, and everybody. But they are worked so so to death, they are not able to give that. They are not able to even take care of themselves.
That's right. Yeah, it's not like they don't care.
They do. They do care. Many of them care.
It's just tough.
Yeah, it's tough for them because they lose it. You know how it is, Peter? You go in the morning, fresh mind. By the evening, it is turned around.
Right.
Really?
Right.
My,
It's sad. It's sad. It's because of the way the structure is set up.
See, my capacity to be in the present helped a lot. It's not just something like a word. I really be in the present, whatever I do.
Right.
And then things take care of this because what I do now, well, that helps my future. Tomorrow is better to me because I live today well.
Beautifully said.
This is a practical thing, right? This is a practical thing, but we don't do that. We get carried away with so many things. But if you are with the patient and you put a hand on him and you kind of empathize with him, you kind of feel what he is feeling, and you kind of validate that, you kind of give them that humane touch. Apart from technical excellence, all those things we are supposed to know that. But that should not undermine your humaneness, Peter.
It's so important. And I don't know that I don't think they teach it, do they? I mean,
no, actually, the system invades that humaneness. Dehumanize doctors while they're going through the residence. This is a big system criticism.
Yep, dehumanize, desensitize.
Yeah, dehumanize doctors while they're going through residential, and then they are given now so much work, they cannot have the opportunity to be that.
I wonder if that's just, I always say in the West, is that, I don't know if it's like that abroad.
No, there's no West and East anymore.
I don't know the metal. Thankfully, I don't know.
Say there is maybe some traces, but there is no East and West. Everything has become all over. Say, for example, in India, how many people really know what is real yoga? Even people do only physical yoga. How many people do you think you are doing? Very little percentage.
Very few now. It's all physical.
No, it is much better than 20, 30 years ago. But still, the way I go to the depth of yoga, they will be flabbergasted. You are living in the States and you learn all these things, they ask me. Then I ask them, you live in this country, why are you not learning English?
Because they're there.
And they get offended, they get angry with me, but that is the truth.
Yeah.
So it's a question of prejudicial mind that is intellectually oriented, that doesn't open the mind to really explore new things or old things that were good. And it's kind of protecting something, oh, I have to say I'm more modern minded, more scientific. What about the problems with the science exploration?
Yeah.
What about not implementing what is properly scientifically proved? Why are you allowing the diabetes to be uncontrolled in so many patients? Why don't you have a voice against these fast food chains? Even this one is on a massive scale. What I'm saying is, hey, healthcare is really broken. Too much money is spent. Even then, it's not working very well. Be aware the changes that are happening, and be aware the consequences that could be, and be aware of the solutions that are available to you right now. And don't wait.
Aware.
Yeah, aware, and then implement them.
Yeah.
I get very passionate about this because I see so much suffering, so much suffering.
Yeah, I'm glad you're doing the work you're doing. Thank you for being in service, my friend. Yeah. Namaste.
Bye-bye. So that's about it. We can get excited and all that, but the main thing is we could take healthcare and wellness into our hands, each person, and we can educate, we can empower ourselves with a lot of tools, and we could really make a difference with the people who are suffering. It could be our grandparents, it could be our parents, it could be us, or it could be our kids, So we all have that responsibility. That's why I want to create this movement of proactive wellness as a habit, as a lifestyle. Okay. Thank you, and I'll be seeing you again tomorrow morning at 8 o'clock. Okay. Bye bye.